Good day, everyone. We are presenting on pharmacodynamics drug-drug interaction. But before we start, what is pharmacodynamics? Pharmacodynamics is the study of how drugs affect the body. It involves understanding the biochemical and physiological effects of drugs, their mechanism of action, and their relationship between drug concentration and the effects. In a layman understanding, it is defined as how the drug affects the body. So drug-drug interaction occurs when one drug affects the activity of another drug when they are co-administered. This interaction could lead to decrease or increase in the effectiveness of the drug or precipitate toxicity of one or both of the drugs. Then pharmacodynamics drug-drug interaction occurs when two drugs influences each other's activities directly through their mechanism of action or by acting on the same physiological system. This interaction usually occur at the level of their pharmacological effect, altering the body's response to either or both of the drugs. These changes in effect is usually not due to drug concentration, but their interactions at the site of action or target.
I'll be talking on the classification of pharmacodynamic drug-drug interaction. One, addictive effect. An effect is as addictive when the combined effect of two drugs equals to the sum of their individual effects. Example, opioid analgesic and benzodiazepine. The second one is synergistic effect. An effect is synergistic when the combined effect is greater than the sum of their individual effects. Example is antihypertensives and diuretics. Now, the third one, an antagonistic effect. An effect is antagonistic when the combined effect is less than the sum of their individual effects. Example is beta blocker and ACE inhibitor. First one is potentiation. One drug enhances the effect of another drug without affecting its own effects. Example is warfarin and NSAIDs. Now, these ones I just explained are the major classifications of this pharmacodynamic drug-drug interaction. There are other less common ones like inhibition, where one drug reduces the effect of another drug without affecting its own effect. You can see this where beta blocker inhibits the effect of dopamine on the heart. Then another one is enhancement. One drug increases the effectiveness of another drug. Example, the combination of sulfonylureas and metformin. Then the next one is interference. One drug interferes with the action of another drug. Example, the combination of tetracycline and calcium supplements. Some other common examples of pharmacodynamic drug-drug interaction exist when using anticoagulants such as warfarin and antiplatelet agents such as aspirin, which both drugs affect blood clotting, with warfarin inhibiting vitamin K dependent clotting factor and aspirin inhibiting platelet aggregation. Now, when you combine these two drugs, they can cause a significant increase in the risk of bleeding. Another interaction exists when using benzodiazepines such as diazepam and opioids such as morphine. Now, these two drugs have depressant effects on the CNS and they can lead to enhanced sedation, respiratory depression, and potential overdose when used together. Another interaction exists between beta blockers such as propranolol and calcium channel blockers such as verapamil. Now, these two drugs, they reduce heart rate and lower blood pressure. Now, when you combine these two drugs, they can result in an excessive decrease in heart rate known as bradycardia and a drop in blood pressure known as hypotension. This interaction can also exist between diuretics such as furosemide and angiotensin converting enzyme inhibitor such as lisinopril. Now, these diuretics like furosemide increase the excretion of salt and water, reducing blood volume, while the angiotensin converting enzyme inhibitors such as lisinopril reduce blood pressure by inhibiting the conversion of angiotensin 1 to angiotensin 2. Now, when they are taken together, they can lead to a significant hypotension and electrolyte imbalance. Now, we have some other drug-drug interactions which can exist between NSAIDs and antihypertensives. They can exist between monoamine oxidase inhibitors and serotonin selective reuptake inhibitor. They can also exist between sulfonylureas and beta blockers. Note, pharmacodynamic interaction can be beneficial or it can be harmful. Now, understanding this reaction is very crucial for safe and effective drug use.
I'll be talking on the mechanisms of pharmacodynamics drug-drug interaction. Number one is receptor interaction. Drugs may compete for the same allosteric site or receptor. For example, the beta blockers and the beta agonists. Beta blockers bind to the beta receptors, thereby inhibiting the binding of the beta agonists. For example, in a situation where you administer propranolol as salbutamol, propranolol will bind to beta receptor, blocking the binding of the salbutamol. The second one is non-receptor interaction. Drug may have interaction at different sites that influence the same physiological pathway. For example, NSAIDs, we all know that it inhibits prostaglandin, which is a vasodilator. So when in a case where you administer NSAIDs as an antihypertensive, this NSAID inhibiting the prostaglandin will decrease the effectiveness of antihypertensive in the physiological system. The third one I'm going to talk about is the physiological system interaction. Different drugs affecting the same physiological system or function can interact. For example, the central nervous system depressants such as benzodiazepine and alcohol. When you're taking benzodiazepine and also taking alcohol at the same time, there will be an increased depressing effect of these two drugs.
We have clinical implications. Under clinical implications, we have therapeutic benefits and adverse effects. Now, under therapeutic benefits, we have improved efficiency. Combining drugs with synergistic effects can improve treatment outcome, such as cancer therapies, which drug combination can enhance tumor cell care. Another therapeutic benefit is that the reduced dose, like addictive effect can allow for a lower dose of individual drug, reducing the risk of side effects. Just like you know that when a lower drug is given, that there will be a low accumulation of the drug in the body, and when there's a low accumulation of the drug in the body, there will be a low side effect. So we have other side is the adverse effect. We have increased toxicity. Like synergy and or addictive interaction can lead to increased toxicity, such as combination of two CNS depressants like alcohol and benzodiazepine can result to respiratory depression, and sometimes can result to coma or sometimes death. Now we have reduced efficiency. Now, reduced efficiency, antagonized interaction can diminish the therapeutic effect, such as using NSAID with anti-hypertension drugs, potentially reducing the blood pressure, or also some drugs like vitamin K and the omeprazole, which can inhibit the absorption of vitamin K in the body for someone suffering from deficiency of vitamin K.
Taking up from my colleague, I'm going to be speaking on risk factors for pharmacodynamic drug-drug interaction. Number one is polypharmacy. Polypharmacy is when an individual takes multiple drugs at the same time. The more drugs a patient takes, the higher the risk of interaction. Number two is age. Elderly patients and infants are more prone to interactions, in the sense that in elderly patients, there is reduced physiological functions of their organs, and in infants, there is underdevelopment of certain organs that are involved in drug metabolism and excretion. Number three is comorbidities. When an individual has multiple health conditions, they are prone to drug-drug interaction. Hepatic and renal functions, impaired liver and kidney function can affect the way the drug is metabolized and excreted from the body. Genetic variations can also be a risk factor to this drug-drug interaction. Another risk factor is alcohol and substance use, dairy factors, non-adherence, lack of communications by the healthcare provider. Understanding these risk factors for pharmacodynamics drug-drug interactions can help in managing and mitigating it effectively.